I'm pleased to welcome you all to this second session of a series of 3 webinars with the highlights of the new WHO implementation tool for HIV PrEP. As people know, in September 2015, WHO issued a recommendation about PrEP in the sense that oral PrEP should be offered as an additional prevention choice for people at substantial risk for HIV infection as part of combination HIV prevention approaches. WHO focused on the development of a series of modules to support the implementation of PrEP among a range of populations in different settings over the last couple of years. And those modules have been released in Paris earlier this year in July. They are accessible at the link provided in the invitation to this webinar. You may look back at it. This series is intended to help people approach the content of these modules that are very useful. We already had one, the webinar focused on providers, which is sort of the more general session we had, and it touches not only module 1, which is actually the clinical module, but some others with relevant information. And the webcast for that webinar in both English and Spanish is available in the invitation as well as links provided within. So this second session, the idea is to introduce the WHO implementation tool to the community and summarize the most relevant information for community leaders, community educators, peer providers, and potential PrEP users. The third session was going to be in December, but part of it, mainly the monitoring and evaluation content, is not hasn't been released yet. So it was just decided with WHO that it's preferable to wait until January for session 3. So we won't have the third webinar in 2 weeks as originally announced. We'll soon announce when it's going to take place. So for the time being, we'll focus on our webinar today on communities, and we have 3 excellent speakers, Javier Urcade, Pedro Carneiro, and Maureen Milambe. So Javier Urcade is a social communicator and journalist who has been working in the HIV/AIDS field for 30 years, particularly in Latin America and the Caribbean. He's the chair of the board of directors of the Global Network of People Living with HIV and a member of the Latin American Caribbean delegation to the Global Fund to Fight AIDS, TB, and Malaria. He's a member of the PAHO and WHO Technical Advisory Committees for HIV, and currently he's the editor of the Key Correspondence team and coordinator of Quiero PrEP, a new initiative about PrEP. Now, Javier would present sort of the general aspects of the modules. Then we would have Pedro Carneiro. Pedro is the Director of Population Health at CALLEN-LORDE Community Health Center in New York. In that role, Pedro oversees quality assurance and improvement of projects, maintaining registries and improving workflows. Pedro's work in PrEP implementation has been recognized internationally, and in 2016 he was awarded the Joep and Jacqueline van Tongeren Young Investigator Award by the International AIDS Society. He's a trained epidemiologist and focuses on LGBTQ healthcare disparities. He would talk about, from a PrEP activist perspective in the Western Hemisphere, which is mainly focused on men, at least for the moment. And then in third place, we would have Maureen Milambe. Maureen is a project coordinator of a joint advocacy project between the Center for Development of People and Malawi Network of People Living with HIV that aims to improve the engagement of people living with HIV and key populations in the Global Fund and PEPFAR processes in Malawi. She has lots of experience in different projects. She's a leading advocate for HIV prevention research in Malawi. And she was a 2015 AVAC Advocacy Fellow. There, she focused on increasing investment in and access to biomedical prevention methods such as PrEP and microbicides for young people and girls in Malawi. Maureen is going to talk about PrEP and women. No, so it's a very important perspective that fortunately we were able to include here. So I stop there, and Javier, please, could you start?
Sure. Can you see the full screen, and you don't see the box of GoToMeeting, right?
Yeah, we see that. People can change the size of the what they see of your screen in their own screen, so it's fine.
Okay, go. Okay, thank you very much, Carlos. So the idea of my session is focusing a bit on the role of civil society leaders and advocates on PrEP, advocacy, literacy, and support, and it's also in the context of the new implementation guidelines that has been published by WHO. So there you have the backgrounds of the, I will not stop much time there because this is the background of the implementation guidelines that has been released in July, and as you can see, PrEP has been strongly recommended by WHO it was recommended in 2015, but lately was strongly recommended as an intervention of the approach for combined prevention. So nothing new about effectiveness and strong advice from the World Health Organization about using PrEP. But of course, there is a slow uptake and implementation in many countries, including Latin America and the Caribbean. So as we know, in July, there was a set of almost 10 implementation guidelines. Some of them, as Carlos said, are not published yet, but the ones that I will be focusing are there in the webpage. So you can download for now in English, but we know that the Pan American Health Organization, together with some colleagues, are working on the translation into Spanish. So could be widely used in Latin America. So one of the guidelines it's targeted to community educators and advocates. And of course, the idea is to promote through this implementation guideline that we reach population, we discuss about effectiveness and acceptability of PrEP and how that could be rolled out in the real world, or let's say out of the demonstrative and other kind of trials that has been going on, many of them very successfully around PrEP. It's also linked this guideline about explain about what is the role of advocates and educators. And you will see as I progress in my presentation that education, PrEP literacy is becoming one of the key hot issues, not only in main capitals in Europe or North America or Australia, New Zealand. It's an issue in developing countries. And of course, all the modules, all the implementation modules have up-to-date information in case that someone only download the community educators and advocate guideline. So all have frequently asked questions and some basic information about PrEP in case someone only access to one of the modules. The next module that is always relevant with my presentation and this session of NEMUS today is related to counseling. As we know that in one hand, we do have some small recurrence of some side effects, but more importantly, there is issues related to adherence strategies. We are basically speaking about what we are rolling out now, which is a PrEP using Truvada or the generics version of Truvada. But basically, we will be seeing there is a lot of things going on in the pipeline that we will see different combinations of RAV-based prevention, other PrEPs and injections and other things. So adherence strategy is some way tailor-made for different approaches or use of care professional or people who works in the health system will be prescribing and following up PrEP users. It's also about the peer-to-peer counseling. We know that if in a community, a group of transgender people or gay, bisexuals, and MSM will be accessing to a program PrEP, they need to also be enriched by their peers. And after more than 30 years of epidemic, we know that that's very efficient way of working with communities and key populations. And of course, there is a need, a concrete, clear need about PrEP advocacy, and this is targeting leaders and decision makers. We need to inform them what PrEP is, benefits and limitations. We also need to create space to leaders, whatever are decision makers in the government, in other agencies, funding mechanism, private foundation, but also the leaders of civil society, community leaders that probably do, in one hand, do not necessarily work much on HIV, which is a limitation, or they're not very knowledgeable about PrEP. So one of the things we are seeing before the release of the guidelines is in some way what I call a narrow approach to PrEP. So some of people, we tend to promote PrEP in the so-called North and in Latin America and the Caribbean. We focus too much the speech, and I'm one of the people to blame about that because I run a webpage that is called I Want PrEP in Spanish, is that we sometimes discuss PrEP in isolation instead of thinking that PrEP is an intervention in a more comprehensive approach of combined prevention. So because if we enter into a PrEP discussion with colleagues or decision makers coming from a more comprehensive approach and discussing combined preventions, people will not immediately bring all their reactions and resistance about, oh, this is basically undermining condom use, or what happened with behavioral intervention that are out of fashion, etc. No. If we try strategically or tactically bring the discussion on PrEP as a part of one intervention in a set of probably 30 different interventions on combined prevention that we need all of them, might probably help us on creating dialogues and open people's mind to discuss PrEP. So that's one of my experience working on PrEP for some time. And because we are working with stakeholders that they do have concerns with PrEP, people that we need to speak, and I of course focus on my peers and my colleagues, which are seen there on top of the list, which are people living with HIV, gay, bisexual, and men who have sex with men, transgender, sex worker, people who use drugs, it's not only drugs, but also how we start a dialogue and a debate and a conversation with healthcare workers, the Ministry of Health, people who make decisions on budgets, and all type of leaders. I mean, that could also include media, etc. At some point, as you can see in Spain and the USA, media are writing stories about PrEP, this miracle silver bullet that are dropping new infection cases. So we need to have a strategy of how we work with media to not perpetuate the idea that there is a magic bullet or a magic pill that could by itself control the spread of a disease. So there are many elephants in the room when we work about PrEP, and I will try only to mention a few which are basically linked to the scope of my presentation. And basically, some of those are addressed in the content of the implementation guidelines, and some of them not necessary. And I don't think necessary that is the role of WHO in all the guidelines to address resistance and issues that will come forward. There are many other partners, including civil society, networks, etc., that we need to work together with UNAs, LHOs, and the International AIDS Society, etc., to address some of the issues. There, what you see in the slide is what the tools contains. The tools are not magic, and the tools has been developed with guiding principles, which we know that, I mean, because probably here we have people who in some way are working with PrEP, but it's basically focusing on substantial risk. It's a human right-based approach. It needs to be part of a universal health coverage approach, gender equality, and other health-related rights. Because we will not, no one's having their mind even as a crazy idea of using PrEP as something that will challenge the decision, the individual decision of getting PrEP, for example, or using PrEP, which is critical for the success of the intervention. But civil society in many regions, it's not only an issue of Latin America and the Caribbean, have a lot of reserves or issues that there has been discussing. I'm now in a workshop, and I will probably need to leave the session. Apologize for that very soon after my presentation, because we are discussing PrEP here in Argentina, in provinces, and the PrEP issues with civil society. In one hand, is lack of information about PrEP. We are having debates and discussion with people who basically do not have the opportunity to read about PrEP and have an informed position in favor or against, or something in between. There is a resistance of something so-called medicalize the life of people living without HIV, which is something that we need to address. It's one of the elephants in the room, that this is a strategy that it's taking an antiretroviral drug or medication once a day, or event-based dosages, or whatever approach we will have in the future. It's asking people without HIV to take a medication, but we are not asking all people living without HIV, the rest of the world. We're asking a specific group of people that have struggled to continue living without HIV. Some of the countries where we work in, for example, Latin America and the Caribbean, we do have a lower treatment coverage, or we have stockouts and issues with the budget allocations. So this bringing into the question the discussion about PrEP sometimes is it's challenging. And affordability and prices is an issue. Some countries in the world, including Latin America and the Caribbean, have restrictions to use, for example, the Strategic Procurement Fund of WHO to procure generic drugs. So prices, it's and will be an issue in the future. The issue of adherence, many people from civil society come to us and said, well, this will add into the health budget, will probably go against treatment coverage, which I don't think is true. And also we face issues about adherence, and they have this perception of idea of creating resistance, etc. And that sometimes people who work in PrEP have been accused of undermining condom promotion and use, and other prevention strategy. So, of course, how we work as civil society leaders and decision makers in terms of budget, in terms of the way that PrEP will be implemented, the logistic of PrEP, how we continue prioritizing the investment on an allocation in prevention and in treatment. If we have it in a country a 50% coverage on HIV treatment, it's very hard to argue the case of PrEP. Even we continue saying that we also need to invest in prevention. That's the truth. And we will have people that will come and raise this issue. Of course, informing people who make decisions, who could become future advocates, is very important. And of course, some of the politicians or people who work in making decisions about health budgets and strategies are thinking in short terms. They're only serving in the government for 4 or 6 years, and this is also a long-term investment to basically achieve the 2020 and 2030 targets and control the spread of HIV, which is now, there is a high probability that will happen. And also changing the paradigm about having health systems in our countries made by hospitals and primary care units that are waiting for people to come and ask for services, sometimes pretty late. So I'm finishing very soon, but I want to speak about why we advocate for PrEP. We
I'm at
basically
priority healthcare right here in Marrero.
okay. So let me continue. So why we are advocating for PrEP? I think for me, and for many people who work with us, it's an issue of equity. In most of our countries, PrEP is there, is here, is everywhere, in the wild. People with financial resources, people who have a higher income are buying and using PrEP, and buying and using PrEP through online procurement. And in the best case scenario, they are engaging their doctors or health professionals to help them in their relation with this private use and procurement of PrEP. So I think in my mind and in the mind of many other advocates, it's the advocacy is focused on more people accessing PrEP despite their income or despite their personal financial situation. And it's linked with the right to health. In my case, I spent the last 30 years advocating for human rights and of people living with HIV, and later on access to treatment for people living with HIV and AIDS. And I think we should all now move to also advocate for the access to an effective prevention measures that will keep people living without HIV negative. I don't have, as a person living with HIV, I don't have any issue with my status, but if I can commit myself on a movement on keeping people HIV negative, I think it's a very good idea. And it's also an issue of right to health, continuing to be HIV negative. And of course, we living in a context where not only in LAC, what happens in LAC and probably happens in other regions and in other developing countries, that we do have very basic and unreliable data of condom use across the board. There are some exceptions of countries with good strategic information, but basically most of the country are not in the position to tell us condom use, etc. So we do have approximately an estimation of 50% or less of population in substantial risks that are not using condom, or if we want to put it in a positive way, use condoms. As substantive use, correct use of condom. So we need to acknowledge that people are not using condoms, and will not use condoms. We can continue communicating PrEP plus condom, or PrEP as part of comprehensive and combined prevention strategy, but thinking that we will also benefit a high percentage of people that do not use condom, and we cannot put a gun in their head to use a condom in their sexual relationship. Because we know that at the end of the day, if someone has a sexual relationship without condom and using PrEP, it's unlikely that he will be resulting in HIV positive. The whole discussion, and I won't to extend too much in my presentation, but the STI, the sexual transmitted diseases or infections, is an issue and also an excuse to let's say be a bit anti-PrEP. And I think the spike or the resurgence of syphilis and other STIs is an issue in all the countries of the world. But honestly, STIs has been heavily neglected in all our countries. The STI pandemic, or let's say the epidemic or the resurgence of syphilis in the developed and developing world is something pre-PrEP. So if we want to have an honest discussion about STIs, let's also not discuss only in the context of PrEP. So basically the urgency is to continue doing advocacy. It's important to get very quickly in PrEP literacy, whatever is in the countries that they will be rolling out PrEP at different levels. Let's say, for example, in our region, Brazil, Peru, hopefully soon, Mexico, Argentina, and others. So we, as community leaders and community workers, we need to engage in PrEP literacy with our people. we do need more implementation. We need larger scale implementation programs from the governments or wherever, rather to continue doing demonstration trials forever, because demonstration trials or acceptability trials are very small. And we need to bring into the discussion the price reduction. We do have a very good news coming from PAHO regional procurement system. We need to get better engaged LGBTIQ organization and other key populations, because when the Global Fund to fight AIDS, TB, and malaria finally transition out of Latin America and the Caribbean, will be very hard to bring those organizations of key populations to continue prioritizing HIV. That's a fact, and we need to bring all those leaders to continue working on HIV and AIDS. Of course, marketing combined prevention, not only marketing or position PrEP, and also tell the people good news about PrEP. Inform people that, as we are informing now in San Francisco, New York, or London, how for the first time in history there is a reduction in new infections. Those good news we will see very soon in Brazil, for example. So let's also communicate good news about PrEP, combined prevention, and also what happens with STI. If we do have services on PrEP, we will do have people who will access to STIs diagnosis and treatment more often, and we might probably have in the long term or medium term a positive effect on the STIs. Thank you very much.
Thank you very much, Javier. Excellent summary. And now I would ask Pedro to continue. Please, could you continue? You have the role of presenter now, so you can share your slides now.
All right. So let me pick it up from where Javier left off, and just quickly thank everybody for being here and for the opportunity to present to you all on some of the community role in PrEP implementation, which is something that was very key to the success of our PrEP program here in New York City. So I want actually to really focus on what we saw as the community role and how we integrated that into the implementation of what was one of the first PrEP programs in the United States. So I'm gonna first explain to you a little bit about our population, but then I'm gonna draw a lot from the excellent PrEP implementation tool for the WHO, which brings it together to everybody the key concepts that a community can play. And I'm going to really focus on the second module, which is the one for communities. So just a little bit about CALLEN-LORDE. We are an LGBTQ organization. We serve about 17,000 patients every year, and our mission is to provide quality, sensitive healthcare to the New York LGBTQ community, regardless of their ability to pay. Most of our patients are under 40 years old, 65%. So this is just for you to have a general idea of who are we talking about. And just basically just for you to have a general also idea about our programs. In 2016, we offer 817 PEP interventions. About 35% of our PEP patients transition to PrEP. Since 2014, we have provided over 3,800 PrEP initiations. In 2017 alone, those were 1,000 initiations, and we have currently 2,400 patients on PrEP. Okay, in terms of HIV testing, we do about 8,000 tests and 97% of those are negative, but we did have 70 new diagnoses last year. And you can see here the distribution in the age group, right? The group really impacted by that are those that are under 40 and heavily those that are under 30. So with that in mind, I want to discuss a little bit about the community role in providing this intervention to everybody. And I know Javier also mentioned the community, the guiding principles that you can find on the implementation tool. And I just want to break it down a little bit, the wording in here and how it relates to everybody, right? So I'm just going to read it really quickly. It's important to adopt a public health, human rights, and people-centered approach when offering PrEP to those at substantial risk for HIV. Similar to other HIV prevention and treatment interventions, a human rights-based approach gives priority to issues governing universal health coverage, gender equality, and health-related rights, including accessibility, availability, acceptability, and quality of PrEP services. And some of the words that we see here really bring it together what the community should be doing. And the first of all, it's public health. And it's keeping in mind that public health is something that goes from a population base to an individual body to genetics, right? So when we're thinking about PrEP, we have to think about PrEP as addressing multiple issues at one time, from an individual prevention to a community stigma reduction to closing health inequities that we know that exist in our societies with women, with people of color, with LGBT people, right? The other wording that we find here is human rights, right? And the idea is that communities should not be gatekeepers of PrEP. Communities should empower and educate folks to make decisions about accessing PrEP. We should not be in a position where we're denying people or we are advising them otherwise if there's no counterindication. And again, I'm talking about a community role. I'm not talking about a provider role, right? That's a little different. So when I also see here is people, which you can translate it to patient-centered approach. And what that means is that communities should support patients' needs and develop programs that allow individuals to achieve their goals, whichever it may be. And that's a really acknowledgement that perhaps the person is there for PrEP, but they also have other priorities that might need attention. And we need to make sure that when, as a community, in building PrEP programs, we are building prevention programs, sort of like what Javier was talking about. It's a combination prevention. It's behavioral. It is social determinants of health based. It is about dignity. It is about human rights, public health, and all of those things. And then the other important word here is risk. And risk is really important to remember that risk is a subjective variable. We each see risk with a different light. And the communities should not define what risk means. We should learn about how people understand risk to be, and we should support individuals to make assessments of risk. And we should make sure that people are aware of the options that are there to reduce whatever risk they may find themselves in. The other thing that I saw on the implementation tool that I thought was very important to take a look at was that first of all, that PrEP is that there is a recommendation for PrEP. And I focus on the word recommendation because it's important to keep in mind that we are recommending it, right? Like we're not forcing down anybody. We're not like preventing anybody from getting it. So the World Health Organization recommends that PrEP contains tenofovir, should be offered as an additional prevention choice for people at substantial risk. Again, substantial risk is a very subjective word of HIV infection as part of combination prevention approach. So with this, I want to focus on the sentence, prevention choice for people at substantial risk of HIV infection. And let's think about that there is not a formula for what a substantial risk is, right? Let's allow patients or people or clients or however you define those, let's allow them to self-select themselves to be on PrEP, to say, this is something for me. Let's empower the key populations that we talk about to consider it and to understand that what are their priorities outside of PrEP, but in the context of PrEP as well. What other concerns bring them here? What are the challenges and the barriers for taking this medication, and why or why not this is for them? Right? Think of yourself in a community way as somebody who can help close health inequities by empowering your community to make decisions for themselves. And then lastly, and I was really happy to see, was the word stigma. on the implementation tool. Stigma is a key part of PrEP implementation in a population health level, in a population level in general, because we are really talking about a scar that all communities that have been affected by HIV have, and that is to do with human dignity and with the stigma and discrimination that has been created around HIV and AIDS, right? So I thought that there's a little text that really makes sense and says an approach centered on cultural humility is critically important. And I really see here words of advocates that helped build this tool. And I really want to talk about the importance to understand that the PrEP's role in rooting out stigma in communities and keeping that in mind, right? While you may think of PrEP as an intervention for individuals to prevent HIV infection, keep in mind the myriad reasons for accessing PrEP, right? Like, we don't think of it as something of a person that is hypersexual, having sex all the time needs, right? Think about of HIV as something that can happen at one time. Think about everybody who would benefit from this and the variety of reasons why they would need that. Think about injection drug users or serodiscordant couples or couples where one partner is HIV positive and the other is HIV negative. Think about people that have sexual anxiety for growing in a society where they heard so much about HIV as being this demon that was gonna come to haunt them every time they have sex. Think about people that have sexual compulsion because of discrimination and bullying that exists in LGBT societies, sex worker societies maybe. And think about also people that just want to be on PrEP just because they want to see if that's something for them. And there should be a spot for each one of these people and whoever else thinks this is for them. So PrEP allows us to move past the infectiousness of HIV and focus on the untransmissibility of HIV, right? Through prevention of both negative people and positive people. And I'm really talking about here the idea of untransmissible, undetectable equals untransmissible, right? And coming from both ways. As somebody who is taking HIV prevention, HIV meds for preventing them to become HIV positive, and HIV positive that's taking meds to prevent the virus from leaving their body. And then just to close out, I want to show you a few things that I want you to keep in mind as a community. Who is your team? These folks were our team. I'm this guy over here. And think about if your team looks like your community, if your team talks like your community, if your team knows where your community hangs out, the chances that your implementation will be successful are much greater than otherwise. Think about what your community needs. Like, what are the specific language that your community use? What are the pictures that will make your community feel more welcome? What are some of the questions that your community are constantly asking? What does your PrEP program offer? Do you have a hotline? Do you have webinars? I always put over here what I've learned so much is that PrEP is highly social. It's highly about talking about sexual risk and discussing how people see risk and enrolling people in programs and doing follow-up and checking in. So do you have that infrastructure? Do you need to build that? What does that look like for you? I just wanted to put this other slide over here for you to kind of see how like our workflow works. We have two different types of patients, but basically the general idea is that from the HIV testing, right, to the appointment when you get your first PrEP, regardless of what kind of patient you are and the purpose where you're here, the goal is really to enroll you in healthcare so you are able to come in and ask for what you need. Then I have a little video. I'm not sure if we have audio, but I welcome you to look us up CALLEN-LORDE on YouTube and think about what is your message that you want to give it to your patients. How are they going to understand this? And it's only 40 seconds, so I'm going to play it over here.
Pedro,
okay.
I think
yes.
we are out of time, but I mean, please leave the link and
Yeah,
people
it's right
can,
there.
I mean, in the chat window. Yeah, and
Okay.
people can actually look at it because we
All
are
right.
out of time already. Okay, excellent.
Okay.
I mean,
Okay.
beautiful.
Thank
Thank
you.
you very much. Okay, so Maureen?
All right, thank you so much. So I guess the beauty about being the right speaker is that you always have less work to do, because I can say that already my colleagues, Pedro and Javier, I've already covered part of my talking points. So thanks to you guys. My presentation is titled PrEP, a prevention imperative for women. And so mainly I'll actually speak from a woman advocate perspective. Next slide, please. Next slide, yeah. Yeah, so I guess before even talking about PrEP, I guess it's important to ask ourselves a question: why even talking about HIV prevention for women in the first place? I think it's important to remind ourselves why HIV prevention for women is important. So I think, just like my colleagues have already said, we are saying that access to quality healthy services, including access to HIV prevention services, is a human right. And also data is actually showing us that almost half of the women that are actually living with HIV are not on ART. And even for those that are on ART, not all of them are virally suppressed, which actually means that their chances of them passing on the virus to others, remains high. And the same data is actually showing us that almost each and every year, 870,000 women are getting infected with HIV. And this is alarming, and this actually tells us we need to do something if we are indeed, if we are to get anywhere near achieving epidemic control. And you all agree with me that if you look at the epidemic the way it is right now, is that treatment alone will not help us to achieve epidemic control. We need a broad range of HIV prevention interventions that actually is going to be able to meet the needs of all different populations. So I guess what we are saying is that reaching epidemic control will remain unreachable if we can't close the tap of new infections among women. And the question we should all be asking ourselves is that, are we doing enough to control new HIV infections among women? Next slide, please. Next. All right, so if you look at the recent UNAIDS report, My Health, My Right, it's actually telling us that access to sexual reproductive health and HIV services is still not universally available for women. We're still seeing a large number of adolescent girls and women, all over the world, still not being able to take decisions about their own health. For example, young women and girls, they still require consent, maybe to get access to sexual reproductive health services from their guardians. Even for other women, for the older women, they still need to get consent from their partners. And we are saying that even in a situation where prevention options like a female condom is available, women still have to negotiate with their partner in order for them to use that condom. But we're also saying that young women and girls are at increased risk of HIV infection. Of late, we keep seeing a lot of young women in age-disparate relationships, which actually put them in a disempowered positions, and in such a way that they cannot be able to negotiate for safe sex with their partners. Also, we are saying that to make it worse, the limited choice of HIV prevention options available for them increases, their risk of HIV even more. But evidence is actually showing us that if young women are actually empowered, it usually results in a fall in HIV prevalence. So I guess what we are saying is that women need to be empowered so that they can be able to be in control of their sexual health, and that is actually going to help us reduce the rate of new infections among women. Next slide, please. So talking about female sex workers, they're even at more, at higher risk of HIV infection. Data is actually showing us that, female sex workers are 10 times more likely to acquire HIV than other men. We know that condoms and lubes, are the most readily available HIV prevention interventions for them, but most of the time these interventions, these products are not always available to them. And just like for the other women, we are saying that even when condoms are available for female sex workers, they still have to negotiate with their clients in order for them to use to use those condoms. And we are also saying that we keep seeing an increased rate of gender-based violence and rape cases among female sex workers, and this even increases their risk to HIV even more. Next slide, please. So what do we know about PrEP? I know my colleagues have already, covered this. So now we know that daily PrEP works for both men and women as long as they take it correctly and consistently. And we also know that, of course, it takes longer for a cisgender woman taking daily oral PrEP to actually achieve the required drug protective levels in the blood tissue as compared to a cisgender man. But this does not mean that PrEP does not work in women. PrEP works in women, only that it takes, women need to take a number of doses for them to achieve the maximum or the required drug protection levels. And we also know that the WHO recommends PrEP for all people, both men and women, as long as they had substantial risk of HIV. And this is actually reflected in the global guidance. Next, please. Yeah, so what is it that women need? So I think considering all the above factors, the above factors that I've actually highlighted above, what we are saying is that women need a broad range of HIV prevention choices to choose from. No one size fits all. As a woman, I would want to be given a broad range of HIV prevention services. And I think Javier covered this to say, I think when we are advocating for PrEP, we are not saying that PrEP is a standalone intervention, but we are saying that PrEP should be provided as part of a package, and that people should be able to choose from that package, from that package of a combination of different HIV prevention interventions. So I think that's what we are saying, that women need to be given a broad range of HIV prevention interventions that are actually going to be able to meet their different lifestyles. And we are saying that women need HIV prevention interventions that actually put them in control of their sexual health. And one of them is PrEP. We know that, as I already alluded to, we know that women, when it comes to condoms and others, women have to negotiate with their partners. So what we are saying is that women need those interventions that are actually going to put them in control, so that they do not have to negotiate with their partners. And we are saying that women should be offered information about PrEP to help them make informed choices. I can tell you that I know information about PrEP is out there, but there are still a lot of people who don't know about PrEP. I can give an example of my country, Malawi. There are a lot of people that still don't know about PrEP. So if people are not aware of a product, it will be very difficult for them to make a choice whether they can use that product or not. So we are saying, even for women, they need to be given adequate information so that it can actually help them to make informed choices on whether they want to use PrEP or not. So we are saying that PrEP works, including for women, hence it should be offered for women. And if we are to take it from a human rights perspective, not offering people interventions which we know work is actually denying them their access to their rights. Next, please. Of course, we know that for us to get, to a point where we have access to PrEP for everyone, of course, it will take a lot of passion, commitment, knowledge, conviction from advocates, policymakers, donors, and beneficiaries themselves. So we are saying that I think everyone has a role to play. My colleagues, I think, already mentioned that indeed we need a lot of stakeholders. I think all of us have a role to play to make sure that PrEP is available for women. But what are some of the questions for us to consider when we are planning PrEP, especially for women? There are a number of questions we should bear in mind when we are planning PrEP for women. And the first question is, where can women access PrEP, and how much will it cost them to get there? Like, do women even have control over resources? Do women have control over money, for them to be able to access PrEP? This is an important question for us to bear in mind when we're planning PrEP for women. And our family planning clinics, you know, the best way to offer PrEP to young women. What are we seeing currently in terms of our young women accessing contraceptives in clinics? What is going to be the reaction of health care workers if a young woman walks into a family clinic and asks for PrEP? So those are some of the questions for us to be considering. And will women even have support from their partners and the family members? And what measures are we putting in place to guarantee women that kind of support? And how can we support adherence to daily PrEP for women? We know that PrEP will only work if one adheres, and that when one and that what plans do we put in place to support adherence for women? Another thing to consider is about transgender women. They have their own needs, and it's important to always consider their needs when we're planning PrEP for women. Another important, issue to consider is PrEP in pregnancy. Does PrEP work in pregnancy? I think information given to women about PrEP during pregnancy need to be consistent, and it's important to make sure that providers are not giving confusing information about pregnancy, PrEP in pregnancy, as it is always the case. And the other issue to consider is about awareness raising, as I've already said, that not many women know about PrEP, and as well as access, where they can access it. So I guess it's important to acknowledge that women are not the same, and they have different needs in different parts of their life, and that what we need to be specific when we are trying to reach out to them. I just want to give an example of my country in Malawi. We've been having discussions around PrEP. Of course, at the moment we still don't have guidelines on PrEP, but we are happy that at least our policy makers are opening up to PrEP. We've had discussions around access to PrEP for young women, and there've always been reservations and some fears, and one of them has been the issue of adherence, to say, will young women adhere to PrEP? So I guess I think what we are saying is that there's no way we can put in place PrEP. There's no way we can offer PrEP and not, taking an extra step to put in adherence support mechanism. I think these always have to go together. Next slide, please. So I guess in conclusion, I think what I'm saying is that what I would say is that access to HIV prevention services is it's a healthy right, it's a human right, and that HIV prevention services must be rights-based and informed by choice, and women must be able to choose HIV prevention interventions that actually suit their need, and that actually would be able to put them in control of their own health. And PrEP works for both men and women. And as I said earlier on, we cannot achieve epidemic control if we are not able to control new infections in women. And we cannot control new infections in women if they don't have access to HIV prevention options, which put them in control of their own health. So I guess, just like with any other, new intervention, it will take time for uptake. I know my colleagues said that at the moment, uptake for PrEP is very slow. I think it's just like with any new intervention, people are always, people would always want to familiarize themselves with their products. There will be some people who still have doubts. So it will take time for PrEP uptake to actually increase. And I guess besides this, we still need to do a little bit of more research to understand about PrEP, because there's still a lot that we don't understand about PrEP. And we do believe that through implementation, through demonstration projects, these will actually going to help us to understand what is it, what are the requirements, the specific requirements for PrEP. And just like for any other drug, pharmacovigilance has actually shown that sometimes it helps to unearth issues that were not even observed during clinical trials for that drug. So I think it's important to note that I know at the moment there are a lot of HIV prevention interventions in the pipeline. We have injectable PrEP and others. So I guess whilst we are looking forward to those products in the pipeline, let's not put on hold what we know works. So we know PrEP works, therefore let's give it to those that actually need it. Next slide, please. So So I guess let me finish by this statement, this lovely statement from the WHO director, Dr. Trodes, in which he asks, should we leave fellow citizens to die because they are poor, or millions of families to become impoverished by the catastrophic health expenditures because they lack financial risk protection? Of course not, because universal coverage is a human right. So I guess cost should not be the barrier for people to access what they rightfully deserve. And let's give women HIV prevention options which they rightfully deserve. And let's make PrEP available to everyone, including those women who need it. And together we're going to be able to make universal coverage a reality. Thank you so much.
Thank you very much, Maureen. I think we have three excellent presentations. The only problem is we have very little time. I mean, a couple of minutes for questions, and really, I mean, I'm just thinking on three topics. I mean, that maybe, I mean, where whoever feels they can say something. I mean, we could end with that. One topic would be actually to what extent PrEP is becoming also available for women, I think, in Africa and in the Americas, mainly Latin America and the Caribbean. So I mean, if people, actually the US and Canada as well. So it's and just that's one point. I mean, for very quick comments. The second point is actually PrEP in the wild. I mean, to what extent this is becoming visible in places as an expression of, I mean, groups of people or individuals trying to get PrEP if it's not available in other ways. And finally, whether you guys feel that other regimes that are not daily oral PrEP, maybe the event-driven, the French regime, have a place in our communities. So, I mean, if any of you, whoever wants to respond to that, the three of you.
Carlos, I can start. Can you hear me?
Yes.
Yes. So I would say that that's a very good point regarding the access for women, right, for PrEP. And I think that one of the issues with that is that we have not developed a model of care that like fulfills what women need. We only understand PrEP from like the sexual health approach, right, that we provided to men who have sex with men. So I think that we need to understand what are some of the ways to engage people outside of the every 3-month follow-up kind of the HIV, the people living with HIV, kind of like the model of care. We need to understand what are some of the ways that people access PrEP outside of this kind of like sexual health model. So I think that that's one of the challenges. And regarding the medication and how people are going off to get medication, I think that even in the United States is a reality with the lack of a health system and the cost of the drugs here. And I really don't know what to say about that, right? Like we have very little power to influence in this like massive world approach, right? So I think it takes to the advocacy level, and we're going to continue to fight for that.
Okay, great.
If I may, Carlos, I think you raised up very critical questions, and I think Maureen did a great job to remind us that PrEP for women is an issue we really need to discuss and work more consciously. And thanks for the presentation. Back to your question about PrEP in the wild, it's like PrEP in some of our countries. PrEP in the wild are there. We do not have access to control on that. It's not necessarily a bad thing if we can proactively engage. If we manage to find tools, ways of communicating through social media, etc., to PrEP educate, to provide better PrEP literacy, to promote that people who are using PrEP in the wild are going to do the HIV testings and STI testings. I mean, we will probably reduce the negative sides of those people who are consuming a medication that might probably is not the best way to approach. One of the things we have been discussing with PAHO, for example, and in a few days they will be launching Combined Prevention Under the Spotlight, a very critical publication which also addresses the issue of PrEP in Latin America and the Caribbean. One of the things we have been discussing with Giovanni and other people in PAHO is the issue of strategic information and data. People who use a product in the wild not only might probably not have access to proper medical care, testing, and adherence and support, but also this is a gray zone where we do not have access for notification and for assessing how well PrEP it's going in people in the wild. But that's a reality, and we need to do our best effort to access to these people using PrEP. Thank you.
Okay, thank you. Maureen, anything to add?
No, I think they've already covered it well. I think for PrEP in the world, I think I would just emphasize that in access to information, I think we need to make sure that information is, we have increased awareness of PrEP out there so that everyone has access to the right information and that they are able to make the right decisions. And for women, I think, as I said, we need to understand the lifestyles of women. What is it that women need, and maybe we can borrow something from the contraceptive field. How is it working? So I think it's all about understanding the lifestyles of women and what women actually need. Yeah.
Okay, great. So thank you, the three of you. Thank you very much. I think it's been a very informative and very participatory session. Thank you very much. We have recorded this session. It's going to be uploaded to our YouTube channel and to our website. So thanks a lot. And you know, our third session oriented to programmatic managers has been rescheduled for January. We'll circulate the information as soon as it becomes available from WHO. So thanks a lot, and we keep in touch. Bye.
Bye. Thank you so much.
Bye. Bye.
Bye.